I'm Nicole. In section 4, I will be demonstrating insertion and irrigation of an NG tube. First, I will check my standard protocol. I will check the medical record for the size, type, and purpose of the NG tube ordered. I will gather all my equipment, go into my patient's room, do my hand hygiene. I will check their name band. I will look for I will ask them to state 2 identifiers. I will ask if they have had any broken nose or any nasal surgeries. I will check both nares, the oral cavity, and I will occlude each nair and choose the nair with the best patency. I will now measure the estimated length of my tubing. I will check from the tip of the nose to the ear and from the ear to the xiphoid process, and I'll mark that because that is where it will be in the stomach. That's the estimated length that it will be in the stomach. And now I will do my hand hygiene once more. I will apply my clean gloves. Well, before I apply my gloves, I will get some tape ready. Now, done my hand hygiene, I have now applied my gloves. I will now moisten my tubing and lubricate about 4 inches. My patient would have been in the lowest position. I will now make sure they're in high Fowlers. I will tell the client that insertion's about to start. I will have them extend their head back. I will slowly insert the tube until resistance is met. I'll check the oral cavity, making sure there's no coiling. I will now have them move, extend their head to their chin to their chest, and as I'm inserting, I will have them sip in, advance, and I will once again check the oral cavity, making sure no coiling has occurred. If gagging or coughing would have occurred, I would withdraw, allow them to rest, and then continued. I will temporarily tape my tubing to the cheek until I verified placement. And then, to verify placement, I will ask the client to speak. I will insert. I will withdraw contents. I will check the pH. I will either insert the contents back in or insert an air bolus. And as I'm doing that, I will auscultate all 4 quadrants. And this would be done under the gown, making sure I'm able to hear. Starting at the lower right quadrant. I've listened to all 4 quadrants. Now I would anchor my tubing to the nose. I have a Y-shaped piece of tape prepared. I would coil this around the tubing and I will attach a safety pin and rubber band to the tubing, securing it in place, making sure they have enough room to move freely without pulling out their tubing. Just doing simple slip knot. Now, the client would more than likely be sent down to X-ray because that's the most proper way to check placement. I will document the NG tube length, size, type, the color and consistency of drainage, the client's response, the instructions I gave them. This would be recorded into intake and output. I would measure the amount of drainage and record that and the pH. And this is my documentation card. I would have checked my 4 Ps before leaving the room. I would have double checked for any allergies before I had done this procedure. And I would have placed a towel on the client's chest. Now I will come back and they have had an issue. I would irrigate. I will make sure they're in high foulders. I will place a towel over their chest. I will disconnect the NG tube from suction and I will check the placement of the NG tube. I will use a 30 milliliter syringe. I will obtain after disconnecting from suction, I will aspirate 30 milliliters of contents. I will place the stethoscope over the left epigastric area and reintroduce the contents. I will Now, I would have heard a swishing sound. I will now instill 30 milliliters of sterile water in normal saline. I will withdraw the solution. I would reconnect the suction. I will now document the type and amount of irrigation solution, the difference in volume between what was instilled and returned, any difficulty irrigating the tube, the client's response, and my teaching.